information on leadership development for anyone that is interested in learning more about that.
Oh, okay. All right. Thanks.
Thank you.
So I'll stay here. Okay.
I'm going to tell you about the data. Hello, everybody, and happy Tuesday. Very glad to be here with you this morning. Very excited to not just talk about data collection and evaluation. Oh no, I lost my slide. Oh, I want to talk about how do we make numbers spicy? A lot of times when we talk about things like data and evaluation, a lot of things come up, and for some of us, it's positive things. For some of us, it's not so positive things. So I just want to take a little time and talk about that for a second. So, am I still within the camera range? Okay, I'm a wanderer. I'm a chronic wanderer. I'm sure there's a diagnosis for that, and I probably have it. Okay, so why data matters. It's important that we're able to be witnesses. And I want to approach the data conversation from a different angle than maybe most people approach it, because I actually believe that everybody that gets involved in this type of work, it's because somewhere inside of us, we have a deep desire to see the world change for the better. And that is the compelling thing that gets us out of bed. That's the compelling thing that gets us through when things get difficult, when things get tough, when we aren't sure how things are going to go, when we're at the very end of a funding cycle and we aren't sure what's going to pick it up, when a need arises in our community and we have no clue and we don't know where we're going to get the resources to meet that need. We have this deep inherent desire inside of us that believes that the world can be changed for the better. And I believe data is a big part of that story, because we change the story, or we change the world by telling the story. And any major thing that has ever changed in the world, it took place because someone was able to give a compelling story about what was going on and what needs to happen. And that's what data can do for us. So, but I do want to open this question up for those of you in the room and online. What feelings come up first when you hear the words data and evaluation?
Dread.
What did you say?
I said dread.
Dread. Yes.
My first reaction was how objective were the questions that you got asked to get the information that you got.
So the quality of the questions, how are we even getting the data? Is it quality data? Very good. Any other questions in the room? Or statements? Yes. Conviction. Tell me more about that.
Oh God. Just basically validating the work that you've been doing, or not validating the work that you've been doing. It just like really tells a story of whether it was effective or not.
Thank you. And one thing I love about data and how we use data to tell the story, it's a truth teller. The data doesn't lie. Say that again? Telling the story with numbers. Yes, yes, very much so. Is there any comments online or anything in the chat?
We do. We have a couple of comments. So, for evaluation, Emily feels opportunity, which I think is fantastic. And then Enrique often wonders if anyone will actually read the evaluation and data. Good
Yeah,
question. And then Sandra would also like to say something. Um,
go for it.
Good morning. Can you hear me?
Loud and clear.
Okay. Thank you, everybody, for the time. My perspective on data and evaluation is I always look at how it honors our Indigenous way of knowing and how we uphold community trust and reflect on the lived experience. So it's more of a qualitative rather than quantitative, and not to just simply measure program outputs, but really how does that evaluation support healing, cultural continuity, and community well-being, rather than imposing outside Western mores and metrics as the way to capture our knowledge and our ways of thinking and talking, that's empirical data as well. So I always go into the weeds with that, which sometimes really resets the conversation and also frustrates colleagues who want a quick fixed answer.
Thank you so much for that. I love that. I love that. And that shows the power of data because there's a long range. We went from dread to a container for wisdom, right? A mover of things that need to be moved, all the way to, is anybody ever going to read this, right? It's a very powerful thing. It brings up a lot of things in us. And so what I really want to focus on are these guiding principles, mainly. Because data can be, and I love what was just last said, sometimes data can be weaponized, right? Sometimes data can be misused, right? So if we're going to center ourselves around some principles around data, these are the three that I always rise to the surface. Now, this is aimed mainly for health council coordinators or health council leaders, but I think this serves a lot of people for the reasons that I'll get into. One, data is proof or the story, right? And the story. Not just compliance. It's not just something that we do because we have to do it. I mean, sometimes it starts that way. But like you mentioned earlier, it's proof, or as I call it, bearing witness of what's going on in our community and what we're doing about it. And is it working? Is it not working? Can it improve? Are we doing a great job? But I also want to talk about good enough data, and this is what I mean by this. And I don't mean bad quality data. Please understand what I mean when I say that. Data beats robust data that never gets collected. So when I say good enough data, I've managed a lot of projects over the years, multiple large federal grants, with very deep evaluative processes, with multiple partners. And what I know is that you can have the most sophisticated data collection system ever, but if nobody uses it, or if you're doing your data backwards because the reports do, right? And you're trying to figure out, oh, well, how did this work? And what, am I preaching to the choir? Okay, yeah. Reporting is easy when the story is clear. I want to elevate the story, not because of low quality data, but I do want to talk about low friction data. And I think that's important that we emphasize low friction data so that we can use data in the powerful way that it can be used. Oh no, I can't see this whole slide. Can we, oh yes, there we go. Now, as I mentioned before, I believe data is a means to changing the world. And one of the most inspirational quotes that really shifted the direction of my life when I heard this about 15 years ago, it comes from Margaret Mead. She's a famous anthropologist. I don't study anthropology. I don't know anything about Margaret Mead, but I know that these words set a fire under me. And so it's never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. I just think that's true. I think that's wisdom right there. And so I want to talk about how we use data as thoughtful, committed citizens. Next slide, please. Oh, wait, no, I have this. When we tell our community story as a thoughtful, committed citizen, that data becomes something different in our hands. As we mentioned before, some people can misuse data. Some people use data as a weapon. We can use data as a healing tool because we have a different insight as the witnesses that bear witness to our particular community, right? So the community story must be told by a local witness. That's important because people can look at data or health indicators to be specific from the outside. That's very easy. I can go to DOH's website and look at the latest data about any particular health indicator. That's not hard to do. But when that data is told through the lens of a local witness, it can be a very powerful tool. Data helps tell that story of your community. Your context, and you're going to hear me say spice a lot today, your context adds spice to the testimony of your impact and what you're witnessing. And so when I say make data spicy, again, let's emphasize the story. Let's emphasize what's taking place. Let's emphasize through the eyes of local witnesses, those committed citizens that are there to change the world for their community. What does that look like? Because a lot of times, I've read a lot of spreadsheets through the years with lots of numbers. There's no spice, very bland, right? We need some chili in our situation, right? Data and evaluation tools will help you become more effective, a more effective agent of change, or a thought leader to other agents of change. One of the things that I think brings us a lot of grief is the misuse of power. It's often difficult to speak truth to power. But again, we said data is an indicator of truth. Data in the hands of a local witness is the ability to speak truth to power. It's to be a thought leader, even if you don't have all of the impressive initials after your name or you hold no major power because the numbers don't lie. So, where do we get stuck with data? Where do we get stuck with evaluation? What's the hardest part in real life? And so we'll just kind of talk this out loud as a conversation as we did before. Anybody in the room, where do we usually get stuck with these things? Yes, sir. Yes, yes. Yeah, that's what I'm doing. Yeah. Yeah, so what he said was sometimes you're waiting on other partners to give you data, right? And maybe you can't tell the full story because you're waiting on a piece that's missing. Did I capture it pretty much? And that can definitely cause some anxiety. Anyone else in the room? Yes, sir.
When you're doing, thank you, Kayla. When you're doing qualitative and quantitative data, like sometimes you're looking at something that's going to be significant, but then you don't realize that the data itself is actually significant within each other, and you just don't see it after a while. And it's like, it takes somebody to, like a third person perspective to come in and say, hey, you missed this. You know,
Yeah.
like sometimes you're just looking too hard and sometimes it's just right there in front of you, you know?
Yeah, absolutely. Absolutely. Even bringing that back to the local witness. Some people are going to have insight with certain things that are being tracked. And some other people, it'll be completely benign to them because they don't understand the cultural context or whatever context the situation is. I get stressful just asking this question, but what's most stressful when reporting is due? Not having the data. Yes. Yeah, if I hear something that's not spoken into a microphone, I'll repeat it. Yes.
Thank you. Currently, right now with administration, you can't say certain things. So having to like code switch and be more reserved with what you're actually doing. Like what I do is primary prevention, but embodied in it is harm reduction, and they're like, do not say harm reduction, or like It feels kind of threatening, honestly. The whole weaponized of data, like, we can't really say what we're doing, even though it's impactful, because we don't want to get in trouble from our funders. So,
Yes, absolutely. Anybody online? What's most stressful when reporting is due?
We do have some comments from Emily. So if you would like to come on and speak to that, you are absolutely welcome. But she says that I think people often get stuck using data to report per requirements, but not for actually mobilizing changes to the project implementation or improvements.
Yeah, I think that's very much the truth. Sometimes we're just doing it because we have to do it. And it's not that, it might not be that you don't recognize the power of what you have. It's that you have 52 deliverables and half a FTE, and you're trying to make this work. You're understaffed, you're under-resourced, you have multiple needs in your community. Maybe you just don't have the time. Maybe you don't have the energy, right? That can be difficult. And so for many times, it's not that we think the data is unimportant, it's that it gets lower on the priority list because we're trying to put out all the fires we're trying to put out. Oh, can we go back to the slide?
I also have a comment from Enrique, sorry, that we can't say equity, yet it's in our name. Sometimes funders change what they want you to report. So I know that can be a challenge. And then
Yep.
Brenda also has her hand up when you're done with that.
Go for it, Brenda.
I was just going to say, for me, it's sometimes interpreting whatever data we've collected into a powerful statement. We might do a survey, but how do we select what's the best way to say that and interpret it?
Thank you for that. Hopefully one of the tools that I'll introduce today will be useful for that specific thing for you. One final question. What makes it hard to give a local picture to funders or partners that are not local in proximity to the community you serve? Has anybody ever dealt with that issue? Yes, sir.
Yeah, one of my federal grants, we had res writers, and it was reporting about like our culture and tradition and language, and trying to explain to them that like the language in itself describes like how we interpret, like how I talked about yesterday, the water cycle. But in Tewa, because it's not a written language, and they're like, well, how do you capture that? And I said, well, it's a qualitative data component. They're like, well, we need you to document that. And I said, I can't. So it's hard to explain that sometimes, and that's where we run into issues on the tribal level is like we have a lot of this qualitative data, but we just can't put it on paper. It's very like verbal,
Absolutely. Absolutely. Thank you for that. Thank you for that. Let me get one from online if there is one around that. What makes it hard to give a local picture? Oh, go ahead.
Oh, if we could hear from Sandra, if you want to come on and speak to that, Sandra.
Yeah, I kind of have a career wrapped around this third bullet. And what I have learned over time is that the challenges in sharing data and creating a collective statement, it usually lies in balancing cultural protocols. And culture is not always in the context of indigenous. You have a culture of a system like a school or a public health facility or a clinic. So creating that collective statement and balancing the cultural protocols, the historical harms that have happened within communities, especially within our state, which is referenced as historical trauma, or, we work on restorative justice, trauma informed, there's all kinds of labels. But how do we identify that? Because it impacts the power imbalances. Because a majority of funding and where data is needed on a Western plane is to justify and be accountable to the gaps or the solution to whatever problem you're addressing. And the power imbalances can really give multiple definitions to how we see success and how the responsibility to protect community voice while ensuring any kind of accuracy or meaningful representation, whether it's qualitative or quantitative. So it comes to the system's relational focus on what is our mission, and are we headed in a direction that fits our vision to impact the community, to impact the processes, to find solutions to work past these that are holding us back. And not everything is a deficit model. But when you try to balance that within a Western paradigm where money's tied to these processes, it makes understanding this process very complicated for a systems person or a person in the organization who wants a quick fix, who wants a quick answer, who wants certain things just to continue to roll for compliance or complacency. And so I always look at data as a living, breathing outcome, and Indigenous cultures always start with data to troubleshoot action towards a more harmonious and balanced way of being. And that's not acknowledged by a Western model. So it does really add proximity. But when you have partners out of the system see those parameters, they're willing to have conversation. You just really have to craft the language and craft the data to say, look at it from all angles. I hope that makes sense. But that's kind of what my lived experience and my current challenges in working in community still is.
That made all the sense. Thank you so much. Thank you. So today I want to talk about a few tools. Now, there is a lot of wisdom in this room, both physically and online. And we have the range from beginner to expert. I just saw an expert just sit down. Hello. I'm just shouting you out. You're like, what is he talking about? But these tools are tools that are accessible for anyone and everybody, and that's why I chose them. There are a lot of tools. I'm not saying that these are the best tools. I am saying that these are probably some of the easiest tools. And again, I'm putting the emphasis on low friction. Low friction, because the best system in the world doesn't matter if nobody wants to use it. A lot of times, and I've run into the same problem you've run into with partners, where they're struggling with getting the data in. A lot of times it's not because they're lazy or anything negative about them. It's just your tool is complicated and it's complicating their lives, right? So how do we keep things as low friction as possible? We want to keep it low friction too. So I want to talk about logic models, and maybe you've had to do a logic model as a deliverable, and maybe it became a bear. It doesn't have to be a bear. It can be extremely simple. It can almost be conversational if you do it the right way, and you just know what you're looking for. The RBA process, this speaks to what Brenda mentioned earlier about how do we communicate the data that we're seeing in our community or what we're doing? Then I have a data menu, and I have it at 3 different levels so that you have options that you can think through, and whether you want it to be super low friction or you want to do something more advanced. And then the PDSA cycle, which kind of brings it all together. So, again, ground rules when I talk about good enough data. I'm not talking about low quality data, so again, emphasizing that. I do want to bring a phrase that I used to say from my past all the time. I was a clergy member for many years. Information plus inspiration equals transformation. Right? A lot of times when we're talking about data, we're just thinking about data. I'm asking you to strategically think about the inspiration that goes along with that data, or just connecting it to things I said before. What are you seeing as that local witness? What is the spice? I'm asking you to be just as strategic about the spice as you are about collecting specific numbers or indicators. The 5-minute rule. If we're doing something low friction, I'm not saying that you need to have a stopwatch and time every time you do data collection, but again, I want you to think, how can I collect the proper data that I need under 5 minutes in situations? And we'll talk through some scenarios. Collect easy, report easy. Collect hard, report hard. Some of you have lived this, right? where you have maybe a complex collection process, and then it's time to report, and then you got to pull it all together and figure it out. So how do we keep it easy? How do we keep it low friction? And then the reporting tie. Ensure that your data stays consistent for reporting purposes, but also for grant writing. You can let your data do dual purpose. So that's an important thing too. So when we talk about logic models, and I'm sure some of you have done a million of them, and some of you, maybe you've never done one in your life, but a logic model is a beautiful tool because it does a lot of different things. It allows you not to collect your data in a vacuum, because as extensive as you want to, you can make it connect to so many different things. A logic model prevents a list of events reporting by creating a clear chain from daily work to long-term community change. It also keeps your purpose or mission centered and connected. I believe someone online mentioned that, how it's important that that data that you're collecting, that you're using it in a way that supports your mission. It protects against mission creep and keeps partners likely drawn by the mission connected. So, this is a logic model. I would say this is like maybe a medium level, maybe entry to medium level. I'm going to show you a much simpler one. But just as an example, there are a lot of different things going on in this particular logic model that keeps everything centered. First, there's the situation, and I'm not going to go into this particular thing. I just want to point out the different features of it. You have the priorities, the agreed upon priorities based on this particular program. You have some assumptions that kind of give you an idea of what's going on specifically in that community. So a little of that local spice, for instance, preparedness in these communities have been largely ignored, right? So you're adding a historical content into the situation. Some of the external factors, right? Continuation of funding for preparedness activities. No major disasters occur to divert time and resources. Things of that nature. You're keeping track of your inputs. In other words, what do we have to deal with this situation in this program? We talk about our outputs. This is split between activities and participation. In other words, what are we going to do, right? So conducting workshops, developing product commitments, but then also who are we reaching, right? We're reaching the licensed facility management and staff, the clients, the partners. And then going into outcomes, and this is divided into short, medium, and long outcomes. So immediately we expect to see an increase of awareness and knowledge. Somewhere after that, we're expecting facilities to initiate disaster planning and processes. In long term, we want to see written emergency plans. So that's just one it's an example. This is a simplified one. And I'm not starting at the very beginning. I'm starting at the part that you're most likely going to be reporting on. And so again, it's just simplifying, thinking of activities. What are the activities? Well, what did you do? The outputs. What did we produce? What happened because of what we did? The outcomes. Well, what changed? Now, this is where I say, let's bring something in strategically. Not only what changed, but what context did it change in? What is the thing that you see and notice with your local committed citizens' eyes that brings the spice to this? And so I always like to say the spice tends to live somewhere in between outcomes and impact. The impact, what took place because we did all of these things? What's going on? What is the shift that's taking place because of the outcomes? Now, those of you that have health councils and you have your quarterly reporting, this is something that you have to report to every quarter. So you have to start thinking quarterly because of this. Here's a couple of cases, and this is very, very, very simplified. If you've never done a logic model before, start on this level, but with a little spice. So, in case A, we're working on behavioral health. The activity was a mental health first aid workshop. The output was that 45 members were certified, all right. Or the output, yes. The outcome is increased local capacity for crisis response. But what's that spice though? What's the spice? Because that's an important part of the story, but when you're reporting things, when you want to paint a picture for funders, there are other things that are important. Like, hey, by the way, historically, in our community, first responders are under-resourced and lack training opportunities due to capacity. So as you're explaining your outcome, you can talk about these other things that have been going on. And so when you're reporting, a lot of times these are the things that are left on the beginning of the logic model that don't make it into the report. But you want to make sure that's there. Why? Because you're the local witness. You have the power to shape this story and to use this data for your community. You have the invested interests more so than anybody that you're turning this report in to. Case B, health fair, annual resource fair, 250 attendees, 30 vendors. The outcome, increased awareness of local screenings. But what's my local story or witness? Well, many people assume that they need to go to the hospital ER, right? That's something that goes on in our community all the time. So, I want to do a quick exercise for those of us in here and online. You can write this down if you want, or you could just think it, because we want to keep it so simple that we can just keep it all in our brain, for this activity at least. And I want you to pick on one thing that your health council has worked on this quarter. It could be anything, anything at all. For this particular exercise, something simpler might be nice. And then I want you to think through your activity, your output, and your outcome. But when you get to your outcome, I want you to add some spice. And I'm going to give you 3 minutes to do this for those of you online, and then we'll share what we came up with. Did that make sense the way I explained it? Yes.
I just have a quick question. So for the Health Council, Section 3 of our DOH contract is the Behavioral Health Initiative, and we have to create those work plans. And in those work plan templates, we have it divided into columns. First column is planning the work, then doing the work, tracking the work, then outcomes. So is that an example of a logic model? It also includes outputs at the end of the template as well.
I don't know if I would call it an example of a logic model. I think it definitely holds components of a logic model. I think the key point of a logic model, and right now I'm showing you a logic model, the side of it that we report. The key point of the logic model is making sure, at least in my opinion, I'd love to hear what Dr. Lilly has to say about this, but in my opinion, it's to make sure that you stay connected to your mission, your vision, the community context, making sure that your activities, you can trace them all the way back through your logic model, all the way to your mission. Because again, when we have mission creep, that's when things start messing up. That's when people stop showing up to meetings because they're like asking the question, why am I here? Because they don't see why it's connected to the thing that brought them to the meeting in the first place. Was that helpful?
Yes, thank you.
Cool. That work, Dr. Lilliot? Okay. She's my data hero, so if I get the nod from her, I'm good. All right, we'll give it a couple more minutes. Those of you online, when we get to reporting out, feel free to either write it in the chat or just unmute and speak it out when we get there. Now remember, when we get to the outcomes, I want some spice. Make it spicy for me. I want green and red chili. We want it Christmas, yes. We'll give it 60 more seconds. Twenty more seconds. I know, this is high pressure. All right, let's begin to share. I'll start with online. Do we have any comments online?
I think you can go ahead and start off in the room, and I will let you know if we have something pop up online.
All right, sounds like a plan. Who would like to share what they have in the room here? Go for it. Yes, ma'am.
Okay, so we're with the Los Alamos Health Council and Social Services Division. So our activity that we did all of last year was we published a monthly health article in the local newspaper each month. One of their health council members who's got expertise in a certain area wrote the article and published it with a great headshot picture. Our topics include the role of social services, the role of the health council, because people in the community get confused about what we do. The social services is the direct contact with the public, and we're sort of a support and advisory board. So some of our topics included the role of social services, the role of health council, flu vaccines, sleep apnea, grandparents and kin raising children, measles, etc. And part of that, we also were involved in local events as well, which we publicized. So I guess the outcome would be more visibility for our health council, people being aware of who we are and what we do. We've actually gotten a lot more applications to join the health council because people think we're fun and we're doing a lot of cool stuff. And so we're becoming one of the most popular boards and commissions in our county.
Nope, that was great.
Thank you very much. Now, if we were to strategically add some spice to that outcome, are there any particular things that are going on in the context of your community that would be useful? Oh, yeah, sorry. It's okay. Yeah, it's fine. So if we were looking at those outcomes, is there any other context or particular things going on in your community that make that maybe more special, a little spicy?
Well, I think where we really rallied as a community was during the crisis with the SNAP and Medicaid. And so we all kind of came together in this emergency and provided food at the various nonprofits, at the library, and at other places for people in need, no questions to ask. So I don't know how to translate that to spicy.
The Health Council was involved in leading that community initiative that brought over 2,000 pounds of food together once the message came out that SNAP was shut down for the month. So kind of getting the word out about the Health Council in the local news led to then a community-wide effort that was sponsored by the Health Council.
So, okay. Well, that was beautiful because I heard an activity, I heard the outputs that took place, and I heard some outcomes, but then I heard some community context, right? Then it started getting spicy. All of a sudden, I just heard some facts, but as they continued to talk, now I'm emotionally invested in what's going on. I'm like, yes, they're making a difference in their community. Now, I want to take it one step further just to make it a little more spicy. Can you tell me everything that you talked about, the spicy parts of that, how does that connect to your mission as a health council? And it's okay, I'm not putting you on your spot. You don't have to memorize your mission right now.
Part of our mission is to support people who are low income in the community, lack access to resources, to make sure, equity focus that their voices are heard. And so connecting that through, this was a really easy way to make sure folks that are facing food instability had access to those resources.
Okay, let's bring that home. So I heard an activity, I heard some outputs, which, what I took away from it with my ADHD brain was that people were more aware of who you are and what you can do for them as a health council. And then the outcome Not only did things shift in the community because of that knowledge, but it showed up in a time of high anxiety in their community because of everything that was going on with the SNAP benefits. And this is what I heard when you were explaining your mission, I heard that you like to elevate people that are often overlooked. Okay, now we're telling a story, right? Now it's getting spicy. We didn't just do this one activity, we elevated people that are often overlooked in our community in a time of high anxiety. We're reporting the same exact thing. We're just adding that spice to make sure that we're bearing witness as those committed citizens committed to change. Is this making sense? Okay. I told you I came from a ministry background, so sometimes I sound like I'm preaching. If you feel the need to say amen, just go with it. Just go with it. Let me hear from somebody online.
Thank you so much. So we have Mary from Harding County who shared the activity of transportation of county residents. The output was the number of residents who use the service. And spicy is most of the clients were thrilled to use our service and hope that we will never go away.
Oh, I love it. I love it. I love it. Let's go with Robbins too.
And then, so the activity is San Juan Public Health Office in collaboration with First Nations Community Health Source hosted a World AIDS Day STI and HIV testing event and community health resource fair on December 1st to increase access to testing, education, and local health resources. The output that was produced is a total of 32 individuals were tested for STIs and HIV, and the event saw strong community turnout throughout the day. Attendees were welcomed with snacks, coffee, giveaways, and raffle prizes, creating a supportive and engaging environment. And the outcome was the San Juan Public Health Office made a new partnerships with community resources, developed a stronger relationship to help facilitate linkage to care for HIV, STI testing. Additionally, community partners were given information on resources in the community and are aware that San Juan Public Health Office offers HIV, STI testing by walk-in and appointments Monday through Friday.
I love it. Beautiful, beautiful. Good displays of logic models. They're very simple. Now, like I said, and you might need to move that for the QR code. That was the most introductory, simplest version that I could come up with. You can get a lot more elaborate with your logic models, especially, and I really encourage this, especially on making sure that your activities align with your vision or your mission, right? But anything you could want to know about logic models, if you use that QR code there, that will take you to a phenomenal resource called the Community Toolbox, which I think is out of the University of Kansas, is that right? Kentucky, someone with a K. So yeah, if you want to do a deep dive in that, check that out. I also want to talk about results-based accountability. Again, this is just a very simple tool. And again, everything I'm talking about today is about low friction. This is so simple. It's just the ability to ask yourself 3 questions. That's all you really need to do. And it kind of speaks to some of what Brenda mentioned earlier in her question or her statement. Results-based accountability is a framework used to move from talk to action. It simplifies reporting by describing the story using data, and it helps flesh out the logic model. And it's outcomes focused in moving beyond the counting heads to measuring real community improvement. So this can expand what is communicated in your logic model for the sake of reporting. So when I'm interacting with my data and I'm reporting on it, whether I'm reporting to a funder or my community, I tend to walk through this process as a mental note. Sometimes you might write it down directly, or maybe you just do that and make sure it's represented in what you're writing. That's the key thing here. Low friction, again. These are the 3 questions. How much did we do? How well did we do it? And is anyone better off? It's just that simple. As you're writing down what you're communicating as a local witness and adding that spice, you want to make sure you're answering these 3 questions. So how much did we do? That focuses on the quantity of effort. So an example would be a number of community health surveys distributed in a county, right? How well did we do it? That focuses on the quality, right? The quality of effort. So an example is a percentage of surveys that why am I stuck on this word? That word represents our rural demographic, right? So any of you who have done surveys in rural areas, you know the pain I'm talking about, where it can be very difficult to make sure that all of the populations in your community are represented, right? So that would be a good measure of how well did we do it, right? And then, is anyone better off? And that again connects to your outcomes and impact, right? So, the example of numbers of families who gained medical insurance via council referrals. So, if you did a logic model, you likely have all of these things, but sometimes we miss these things. So this is a very simple thing to make sure that you're touching all of those bases. Just simply asking yourself 3 questions. Anytime you're communicating data, how much did we do? How well did we do it? And is anyone better off? The first 2 questions give the dimension to your activity, and the last question is your impact story. And that's where a lot of the spice will live. This is what, when you're reporting to DOH or any of your funders, this is what the community really wants to know, right? A lot of times we just throw out a lot of numbers because we have them, but what people actually want to know, and connecting with what Enrique said earlier, is anybody even reading this? If it doesn't impact them, they aren't going to read it. Especially for communicating successes to our community. Most people, when they see a bunch of numbers, they just kind of, shrivel up and die inside, right? Some of us are excited by it, but, most people, that's just the norm. But if you answer these questions in a clear way that's easy for anybody to understand instantly with low friction, people are invested in that. That's why we have to keep it spicy, right? Because the spice is where the power lives. Okay, so here's an example. This is RBA in action. This is a food access initiative, right? And so we've got the quantity, we've got the quality, we've got, is anyone better off? So how much? The number of mobile food pantry events held in rural precincts. The number of families provided with fresh produce boxes. So that is the how much. I can say that. The how well. The percentage of boxes containing locally sourced New Mexico produce. Let's just say that's one of the goals. Customer satisfaction with the distribution process, which we'll talk about that when we talk about our data menu of what data are we collecting and why. Is anyone better off? Well, in the quantity, we have a number of households reporting increased fruit and vegetable intake. With the quality, we have the percentage of participant reporting reduced food insecurity and stress. So again, you're answering those 3 questions. When you answer those 3 questions, generally what you're reporting is always going to be relevant. But there is one thing missing. This is a small quiz for everybody, for you in here or online. There's one thing missing that if I wanted to take this to the next level, I would need to add. It starts with an S. What do you think it's called? Somebody knows it.
Spice.
Thank you. Ooh, I was getting really nervous there. Whew, okay. I think, yeah, that's a bead of sweat right there. Okay. Okay, so we're going to do this very quickly, just like the last one. We are going to take a lot of time, but I do want to take at least a few minutes. And we're just going to pick one measure for an RBA question. If you like, and you want to keep it consistent, maybe look at what you already wrote down and just double check to make sure you're answering the 3 questions, right? And it really is that simple. This is a method to make sure that you're hitting all the bases. Sometimes you miss 1 or 2, and that's okay, because this is kind of your safety net. So, you can think of a different thing if you want, but let's just take a few minutes and make sure you answer the question, how much did we do? How well we do it? And is anyone better off? And then I encourage you to add the missing ingredient. What's the missing ingredient? Spice, yes. Whatever spice you choose. I'm a green chili guy, though, I have to tell you.
Maybe I'll take this opportunity to share a comment online from Enrique. Unfortunately, he says that we know that sometimes our funders who ask for the reports do not read them. We know that in follow-up conversations where they ask things that were in the report, which is a bummer.
Enrique, you got an amen from me. Yeah, that happens. That happens. I do encourage this. Anytime I'm reporting, I always have the mindset that I'm not just writing for that report. I'm a big person on being as efficient as possible and lifting as much as I can with leverage. Anytime I'm writing a report, I'm also writing an article for a newspaper or a social media post or language for a grant. And so I always keep those things in mind. That doesn't solve the problem of having a grant and nobody reading your reports, but at least it means your effort isn't wasted. All right, we'll take a few more minutes. I see your spice comment, Joyce. Thanks. That's the word of the day, spice. All right, let's go ahead and share out. Who would like to share what they came up with their RBA exercise? All right. I'm getting my steps in here. Thank you very much.
Thank you. Yadze She'e Arena Bigayensha. I am with the McKinley Community Health Alliance, and what I wanted to share is based on my portion of the Health Alliance, which is the housing justice. That was created out of a HIA assessment, a housing impact assessment that happened in our community, and the social determinants of health, and created my role, which is the housing justice community organizer. And through outreach and working with community partners, when we met with individuals that were impacted by housing instability, they had asked for more of an integrated cultural approach. So that led us to creating what we call medicine bundles, and they were procured mindfully and intentionally and specifically for our community members that are facing housing insecurity. And so that project and the outcome is community-led. It's rooted in community. And the positive part is that a lot of the individuals and community members that are aware of the medicine bundles, they ask for it, and it has been empowering and supportive to them. So that's what I wanted to share. Thank you.
Thank you very much. Anybody online? What do I have online?
So Mary from Harding County mentioned that the transportation, they have 5 drivers with providing over 60 rides per month. And all the clients feel they have support to be able to stay independent and live in their own homes.
Awesome. Awesome. Very good. Thank you very much. Thank you very much. Let's talk about low friction data. And I call this a menu not because this is some definitive menu, because it's not. There are a million things that you can do, and there are probably things that I've never even heard of that you can do that are amazing. But this is a start. The one thing I want to leave with you today, not necessarily is the technique, but just thinking through when something is appropriate and when something is less appropriate. Does that make sense? There are times, and it might be because of your capacity, where you just need to really focus on this fast side of the menu. Because if you're here focused on the deeper thing, and let's say you don't have to do it. Sometimes you have to do those deeper things. Let's say you don't have to do the deeper thing, and you're half doing it because you're so busy with everything because you don't have the capacity. It's not going to be quality data, right? We want quality data. But I could maybe fit in 5 or 6 fast things and maybe 1 or 2 medium things, right? Maybe I have the capacity for that, instead of just one half-done deeper thing. Does that make sense? So these are examples. Again, I'm not saying this is what you should do or what you need to do. But what I am saying is you should always start fast and add medium and deeper as needed. So some fast things. Counts, right? That's easy. How many people showed up? 1 question polls. The power of 1 question polls that could be yes or no answers can be huge. For instance, maybe I don't have time to give everybody a 7-question survey of their satisfaction of a meeting we had. What I can do is say, hey, was this meeting useful to you? Thumbs up if it was, thumbs down if it wasn't. And look around the room and see how many thumbs up I have and how many thumbs down I can do. That took me 30 seconds, right? Now, that might not be enough. It might be enough in your situation. It depends on the capacity you have. If you have a deep evaluation tool that you're kind of half doing and you're just working backwards from reporting, those thumbs up in that room is going to go a lot further. Does that make sense? Photos of deliverables. You don't know how far I've been able to get in reporting with photos. Sometimes I'll literally just take photos of things so I don't have to write anything down. I could sit down and count every person in a meeting, or I could just pull out my phone and take a picture. What do I know all of a sudden? I know how many people are there. I know who showed up, right? I know all of these things. If you did a 1-question poll in a photo, you've got a lot of data just there. That took 30 seconds. Partner commitments. If you agree upon something in a meeting, or if you're working on some initiative, hey, how many people can do this? Raise your hand. That's all it takes, right? That is a partner commitment statement. Now, I could have MOUs signed by everybody, and sometimes you need that. Sometimes you don't need that. If you don't need that, why are you wasting time and killing trees to print out more MOUs, right? As a matter of fact, if you want to be really spicy, you can ask a question while taking a photo of it. Okay, I'm getting complicated. Attendance completion rate. Was somebody there or not? It's just that simple. We have 5 meetings. Was this person there? Let me look at my 5 photos of the 5 meetings. I know instantly. See how quick that is? Resource pickup count. How many flyers, kits, naloxone boxes, handouts were taken? Well, that's really easy. I know how many I showed up with. If I showed up with 100 flyers and I left with 20, that's simple, right? It doesn't take any time. So always start with the fast. If you have 7 of these fast things and none of these other things, you can get pretty far. Now, sometimes what you're working on might need some deeper levels of commitment when it comes to data collection, but honestly, most of what you need will come from this category. It's just a matter of intentionally thinking and being strategic about making it as low friction as possible, especially when you're working with partners, and those partners that you're working with are required to get you data in some way so that you can work on your project. A key thing you want to think through is, am I asking them to collect data in a fast way, a medium way, or a deeper way? Make sense? Can I get an amen? Okay. So medium, this is where we get into the things that are a little more complex. In my experience, which isn't that vast, but in my experience, a lot of people start with the medium, but that's also where I see a lot of people get lost with the medium, right? because we're starting with the medium when there's a whole level of fast before that. So those are things like confidence changes, you know, a pre and a post, how confident were you? But even then, if you think through it, you can make this simple. You can make it a yes or no. You can make it a hands up, a hands down. One thing I love about that is it works on Zoom, right? Hands up or hands down, people just press that little hand up thing and you know. You could take a photo of that, right? Behavior, intention, in the next 2 weeks I plan to, but even then, don't leave that open, give them an option of 4. Most of the time if you give people options, you can even add an other, and if somebody really feels something about that, they're gonna write it on the other, but most people are probably gonna fall, if you're reasonable about it, in those 4 options. Again, quick, easy. A barrier scan. What might get in the way of using this? Instead of just asking that as an open question, which you can, is useful, but if you're pressed for time, a simple list of things that you think are likely could be the barrier that they could support, or that they could just mark off. It can solve that problem for you. And like I said before, you can put that other option. Knowledge check, kind of connected to the first one, where you have a pre and a post. How much do you know about this particular topic? Do you feel like you know more about this topic? Now, sometimes you need to define what more is, by how much. If you don't have to do that, more is enough. I've had very serious federal grants where they're just like, is it just better? Sometimes that works. And then there are the deeper things that any of you who have ever worked, and some of you are in this room, you've worked with me, I always harp on these things. Interviews, focus groups, policy and practice tracking over time, community indicator trends, partner capacity changes. That's something that I think we should measure more, especially in the turbulent times we find ourselves in. That's also helpful in making decisions, and when you plug information like that into your logic models, it can kind of help you coordinate things and adjust things. Network growth, making sure you're aware of your partners, whether there are new added ones. Sometimes there are high turnover in certain positions in certain sectors that we work with, right? Making sure that you're keeping track of that and managing that list, which I've done a lot of training on just that because that can be very important. Any MOUs initiated, things of that nature. But again, the main point of this whole thing is, because this is not a comprehensive list, and you can find many other things that are useful for you. The main thing is make sure you start fast and just think through it. That's all I'm asking. Uh-oh, lost my clicker. Here we go. Yes.
Is this something like the fast, medium, and slow? Is this something that like we could start out with the fast for the first report, and then the second report build on it to the medium, and then the third report like the deeper?
It can, absolutely. It depends on what are the requirements for your report. If you are in the low capacity situation that I described that has fit all of us at some point, and you aren't required to do a lot, then don't do a lot. Do what you need to. However, the caveat that I will always add to that is the more data you have, the more power you have to wield with that data, right? The more you can tell your... Yeah, but exactly the point though, what you said is easing into it, that's a great thing to do. That's a great thing to do. You want to build up to it if you can. And another thing I just know from experience, and not just my own, but just what I've witnessed, is when you master doing 5 or 6 fast things, and that begins to feel like a natural thing that you do, and it just feels like breathing, adding a medium or even a deeper doesn't feel like that much. But if you're starting from scratch and you're just jumping in with 1 medium and 2 deepers, well, yeah, it feels like a different thing. I got the nod from Dr. Lillian. I'm good. I'm good for like the rest of my life. Thank you.
That's a great point. And like keeping in the deeper though. But by keeping in the deeper, you know where you're going. So don't be afraid of those and take advantage of those. So.
Please never be afraid of deeper, especially things like interviews and focus groups. A lot of times we overemphasize, as was mentioned online, we overemphasize the quantitative data and we don't have that qualitative data, and there's so much power in that qualitative data. Can I get an amen? All right. Let's see, how am I doing on time? All right, so another tool, and again, not the most complex tool, very simple tool. Very simple tool that kind of, when you look at evaluation and what generally our goals are for evaluation, this tool will get you a long way. It's called the Plan, Do, Study, Act. Sometimes it's Plan, Do, something else in ACT, but they're essentially the same thing or similar things. They rhyme. This is what I also I've heard it called the improvement loop. It's very simple in that plan just means you're testing a change. Do means that you're testing it small. Study means what happened, and act means what are we adjusting for next time. I'll go a little deeper. So when we're planning, we're identifying a problem or an opportunity. We're analyzing the current situation and developing a hypothesis for improvement, outlining the goals and methods, right? Or you're just testing a change, right? In other words, you're doing all the things you're supposed to do in planning by understanding what's going on and what you need to do about it. A lot of this work can be done with your logic model. A lot of this work is done by your logic model. However, once you do that, and let's say you've done your report, let's say you've done your quarterly report, well, that doesn't mean that we just rest on our laurels. We can continue to elevate forward to that next report. And I'm getting a little ahead of myself, but I think it's important that when we're doing our reporting that we're able to show the story, not only of what's changing in our community, but what's changing in what we're doing to meet the needs of our community. I think that's an important thing to report that we often don't report. And that's one of the reasons why people will lose context sometimes, because they don't understand the story. The story's not being told to them from the local witness that has that mindset and that vision. Do, implement the plan on a small controlled scale, maybe a pilot test to gather data without disrupting the whole system. I'll give you a quick example of that, of how you could do that quarterly, very simply. Study, analyze the results from the do phase. So let's say you made an adjustment, compare that to the planned outcomes to see if the change worked, and act. If successful, standardize the change. If not, well, just don't do it, right? So, plan, do, study, act. Just like RBA, it's just a simple mental checklist you can go through in your mind. Am I doing these things? That's not just for that. This is for after the report. This is how you get ready for the next report. Sometimes you can passively write your next report without writing anything down because you've set up so many low friction data collection methods. You have your system of recording and you've simplified that by the time you work through this process, even mentally, you already know what you're going to say in your next report. Let's look at what this could look like in a quarterly situation, right? So think of you just finished your quarterly report. Before you start the next question, you just want to plan. What are we going to try? Everything that we did in our last report and everything that we reported on, you're thinking through it in your mind. And I start thinking, well, does anything need to shift, right? Did anything need to change? Is everything going okay? Is it moving to the speed I want it to move? Did something change outside in the outside world that I can't control? Yes, sir.
So how does PDSA differ from PDCA?
It's the same thing. It's the same thing. It's the same thing. My understanding is that PDSA is often used in nonprofit or social settings, and the PDCA is used in business settings mostly, but they're really the same thing. Yeah, check. I always forget, thank you. But it's essentially the same thing. So, during that quarter, you're thinking through what happens, right? And you're collecting it very simply so that you aren't thinking of it 4 months later like, oh, what happened? I've never been in that situation ever. No, none of us have. Then study at the end. You just think through, okay, well, what did we learn? If I've already thought through what we're going to try and what happened when we tried it, this is going to populate in my brain pretty quick, right? And then act the next quarter, the beginning of the next quarter. This is what we're going to do differently. Now, I'm going to make a couple of cases based on this, or a couple of statements that I believe very strongly in around reporting. But let's go through some examples first. So let's say I'm just making a change, and it doesn't have to be a drastic change. It could be a simple thing. But I'm going to make the case of why you want to track something like this. Maybe I've been pumping out flyers into my community, and we're hanging them everywhere, and maybe we found that we might get further digitally, so we figure out a texting situation, or we use WhatsApp or something like that. It's just a small change. Another thing is I might want to shorten a survey. Let's say we're doing a survey. Let's say the 7-question survey that I always mention, because a lot of surveys are 7 questions for some reason after you do something. Is there a reason for that, or is that just a pattern that I made up in my head? We'll talk later. But a lot of times you can do a lot of heavy lifting by shortening your surveys if it's to what exactly do you need to know. Not what would you like to know, but what do you need to know? Because again, if people aren't filling out your surveys, and I don't know if you've ever had that feeling where you pass out a survey after you got done with something and you got half of them back and realize that a lot of people didn't do it. But now you have to report on the data of what 3 people did in a 20-person meeting. Okay, I'm not the only one. All right. Adjusting a meeting time or a location for reach. Now, here's the thing. This is a case I'm making. I believe that funders and collaborators, if we have any funders or collaborators in here, tell me if I'm right or wrong. I believe that funders and collaborators love to see improvement. I just believe that. I believe our biggest collaborator, our community, loves to see improvement. Now, you might, and I think it's important, whatever you're reporting to your funders, your community needs to know that too, right? And if you have some type of public thing, whether it's your social media or newspaper or whatever, you might want to let them know, hey, we adjusted this or that. Most people won't care, but what they will know, what's being communicated is, hey, this group is evolving, they're changing, they're paying attention to the needs in our communities, and they're making adjustments, it's keeping it spicy, right? They love to see improvement. You are always improving. Everybody in here. Even if something is going wrong, you're improving by learning what not to do, right? Everybody in here, all the time, we're improving. We're maturing. We're understanding the needs more and more. But does that always show up in our reports? That's the question I have for you. Or does that get left on the table like a lot of the spicy things do? That is the context. Oh, yes. Oh. You got a mic back there? Thank you.
Hi, I was just going to say, I have a lot of experience with the PDCA and PDSA process, and one of the things you really want to make sure you're doing in that planning stage is setting a SMART goal, right?
Yes.
Because you need to know what you're measuring, what that goal is going to be, what the change is that you're looking for in implementing these different cycles. So.
Amen. Yeah. Thank you. Thank you. Yes and amen. Are you communicating the shifts that are taking place? Reports can be that place, and then share those reports. Make those reports do work for you. Like I said, when I'm reporting to a funder, I'm not just reporting to a funder. I'm working on my social media campaigns. I'm working on my next grant, all at the same time, by just thinking through the way that I'm collecting and communicating this. All right.
Joseph,
yes.
We do have a hand raised online as well.
Oh, thank you. Go ahead, Sandra.
Okay, kind of to add to the last comment and where you're going with this, sometimes a pivot point that I've used, or the group will get into conversation around what's the sense of urgency, you know, like the pain scale you have when you go to the hospital. How much is this on our pain scale? How quick do we need to make the fast 5-minute determination? Or can we collect all the fast determinations and then look at it at our next round of team meetings? So there's always a gradient scale of how urgent is this. And if it's urgent and people are not quite on board, even with PDSA, looking at the mission, a root cause analysis. Why are we blocked? Why are we at this crossroads? The 5 whys, I call it. Why? Because a lot of teams we worked with, or I've worked with, they see the model, but it's these communication hiccups. It's this different perspective that we don't give time to, or we treat all processes equally, like everything has this ultimate timeline or open-ended. So really determining the sense of urgency, doing a root cause analysis to kind of work out the bugs and regroup and then redirect from that. And I think teams don't feel that there's that flexibility because they see data as an end product and that it's a race that they have to perfect. And I always share with our teams that data and data compilation and conversation around it is a live process. It's a living, breathing process. So that's just kind of something that I felt, could help with some of the have tos. There's no real etched in stone have to, I found.
Thank you so much. That was great. I really loved, the root cause analysis can go so far and solve so many issues or help you understand the context of so many things. And so Google 5 whys, if that piques your interest, just Google 5 whys. It's a very simple exercise that you can do that can take you very far. Thank you again for that comment.
So just as a follow-up to that question, just so I understand, is she saying that use the 5 whys for the study or the PDSA or the PDCA to figure out maybe why you didn't get to where you're going, or to use that before trying to get to your end result?
Did you catch that question online?
Yeah, it would be both. Once you find that, okay, we're at a stalemate and we got this process going, but we're not all on the same page. What are we missing? Why? And sometimes the 5 whys end up being resolved in the second why. But the 5 whys is to really drill down deep to an issue that you may not be conscious of because it's not your department or you're not actively involved in the issue at hand, but you're part of the team. So it could be either at the onset or in conversation as to how it's unfolding in front of you. And so it's really a good step back to have a respectful conversation. It also helps depersonalize issues when people get heated and passionate, and you just look at the data and say, why? Why are people late every Friday and off on Monday? This is a random example. If you're looking at personnel data and look at all the issues, and then that's where you look at your surveys, that's where you look at your other query systems. How do we capture the staff feedback? What are the supervisors' observation? How does this rely on policy? Why are we not using it? Why is there a breakdown in communication? Why is there a different perception? Why? So you use it in the realm of relation to coming to a solution. And a lot of times people get deadlocked there because they've never thought about it, and it takes time. And I think that's where some administrators or people in authority want to push past it and just move on. And that's your organization's decision if you want to honor it or not. But I always found a lot of valuable impact to clarifying with the people that you work with by honoring the 5 whys. Does that help answer?
Yes, and I think to that point, that's why I think the 5 whys has got to been extended to 7 whys to get a past motivation to break it down even 2 more steps. So thank you.
Thank you, and thank you both for your wisdom. One of the things I love about root cause analysis, or particularly that tool, the 5 whys, is it can be as formal as you need it to be. I've been in situations where we've done root cause analysis over several months with multiple people in the room, or sometimes just asking the question why 5 times in a group full of people and having a conversation. Much like the other tools I showed you, you can use them to whatever effect you need. The key thing is to use it in a way that will allow you to use it. That's the main thing. Okay, so this is kind of me putting it all together. I'm not even going to go through all of it. The only reason why I put these 5 things up is when you do your quarterly reports for the Department of Health, these 5 things show up that you need to answer to. And what I really did was just say, this is how you can use these tools for all of these. But a main thing that I want to encourage is that, and I'm rushing a little because I'm running out of time. The main thing I want to encourage is that you keep this as low friction as possible. Why? Because you have that community witness. You are the one who brings change. You are the one who can truly interpret this data because it's happening in front of you. So I will end this. I might even end this a couple minutes early, because why not? You guys don't mind a little extra time, right? I have one evaluation question for you all, and I'm going to capture this data as you all answer it. I'm asking those of you online, if you could, well, actually, do I want to show my final slide? I'll just remind you, use the tools. I had an exercise, but we won't do it. Just use your tools. All right, if you could just put the people online up there, because I'm going to do a quick exercise. For myself, I suppose. Okay, so I have one question for you. My question is, do you feel inspired to be a community witness and with your data, make it as spicy as possible? If the answer is yes, raise your hand. Okay. Oh. Got to get everybody. All right. Those of you online, make sure you raise up your hand. All right. I know how well I did now. Thank you all. You have been amazing. Hopefully some of this is useful for you. And yeah, power to the people.
Thank you all so much. Thank you, Joseph. There's a raised hand on Zoom.
I've got 4 minutes, right?
Yes, we are going to share a survey in Zoom for this particular training. So Zoom folks, please complete that. For In the House, we're going to do the same thing we did yesterday. If you guys could please jot down on the Post-it notes something that worked for you about this training, something that didn't, and a suggestion for next time. And please put them on those same flip chart pages that we have against the wall. Thank you so much. We will break and come back here at 11:35 for the next piece of our agenda.